Thank you, Joanne, and thank you for hosting and and it's a great conversation. So Apollo Hospitals was founded in 1983 with one hospital, and today it's the largest health system in South Asia. 72 hospitals, 10,000 beds. We've treated 150 million people to date, but that still leaves billions of people who don't have access to healthcare and who still need treatment. Now, how do you really, how do you go beyond 150 million people? How do you treat a billion people? The reality of that is that's not going to happen in the walls of a hospital or a clinic. It's going to happen outside, and it's going to have to happen with new models, new ways of doing things. And that's where that's where we see digital health and technology playing a big role. And we were seeing it before COVID. It was certainly accelerated with COVID. This idea that you can use technology to engage with more people at a lower cost in a more convenient way. And so we just see that trend continuing. And it's not only in South Asia, but certainly in developing countries. If you look at the cell phone model, right? In the Western world, we had landlines, right? We didn't really need cell phones. But why were countries like India and China able to really leapfrog what we had in the West with cellular technology? It was because they didn't have anything before and they needed to implement a solution. Necessity is the mother of invention, right? So we see that happening with healthcare. We have this opportunity now to really leverage technology to drive access as well as lower costs. And now part of that also is you can have a great technical solution, but unless people have the ability to pay for it, it's all for naught. So, the other part of this is certainly the financial inclusion. All great points that we talked about today. The ability to get access to pay for healthcare. And this is where I think, innovative new models for financing, for paying for healthcare come in. So, a good example might be, we talk about public-private partnerships. So in India now we have something called Ayushman Bharat. Colloquially, it's called Modi Care, where it's a program to ensure 500 million people, right? To the tune of roughly about $6,000 a year. It doesn't sound like a lot, but in the Indian context, it's quite a bit. But there's still a lot of treatments that are going to cost beyond $6,000 in a year, especially when you're talking about a family of 5. So when you look at opportunities like, challenges, there are also opportunities in the sense that now could we figure out a public-private partnership where you offer maybe some supplemental coverage on top of a program like Ayushman Bharat to cover more people, to cover more treatments, and not only for acute care, but also preventative care, right? And the reason that's important is when you look at India, in a lot of the other parts of the world, right? Diseases such as what we call non-communicable diseases or lifestyle diseases, such as diabetes, cardiovascular disease, hypertension, cancer. These are actually bigger problems now than, and to Clifford's point, things like tuberculosis, malaria, and HIV. So the ability to treat people, preventative treatment throughout the course of their life will certainly play a big role. And I think we can easily see technology playing a big role in helping manage that.